The nation's top public health agency has relaxed its COVID guidelines, and that means big changes, especially as kids are heading back to school now. Joining us now with what this means for your children this school year and how you can continue to stay safe is CBS 42's Dr. Celeste Reese-Wilis. Good morning, Dr. Celeste.
Good morning. Happy Monday.
Yeah, you too. Thank you for always saying happy Monday, because I don't know if I want to be that positive, and then you bring the light. You bring the positivity. Let's talk about the new relaxed guidelines. What are they?
So the new relaxed guidelines are centered towards a strategy, and it starts primarily with you first identifying, knowing what your risk is. Protect yourself with vaccinations and boosters. Take action if you're exposed and mask. And then number 4, if you're sick or test positive, stay at home.
A lot of people wondering too, like, how long do you stay home? And I guess it depends on, especially if you're working, what your employer would like to make sure, your coworkers feel safe around you. What are you suggesting people do to keep themselves safe as we learn to live with COVID now?
So basically, the guidelines that they talked about center around the individual and knowing what your risks are. So the first thing you want to do is find out, what are my risk factors for disease with COVID-19? Knowing that risk tells you the level of carefulness you need to have. The rules are that there's no longer quarantine period. So if there's someone that's exposed to COVID-19, we want you to get tested, but we want you to get tested in 5 days, or we're going to ask you to mask during that time period. So it's ending the quarantine, it's ending that contact tracing, and also no social distancing. So having yourself protected with vaccinations and boosters, especially if you know that you're at an increased risk for disease, goes a long way in helping to prevent disease in you in particular. In addition to that, you're going to want to make sure you're doing those things that we have known for the last 2 years. We know that the science is evolving. Current conditions are different than there were from 2 years ago, but simple things like hand washing. If you know that someone is sick, you know that they relax the 6 feet social distancing, we still want you to stay away from anyone that's positive or that's sick.
I take heart that we have the cleanest hands in the history of this country, I suspect, after all of this. So there's that. How much of the country currently vaccinated right now?
So currently in the country, there are about 70% of people that are vaccinated. But the reason that they've come forth with this guidance has to do with the fact that studies have shown 95% of America has either immunized or has been positive with COVID-19. And this is providing a level of immunity that they feel like it's okay to go ahead and relax these guidelines and focus on the individual patient to try and get the best protection for them.
Before we let you go, where communities have high rate of COVID, are the guidelines any different?
Yes, they are in fact different. They've put out levels of infection in your community, whether low, medium, or high. And we, of course, in Alabama are at that high rate. At that high rate, they're still asking and recommending that you mask when you're indoors. People may see different things as they go into different places, as businesses, have leeway with, what they want to do. If you're that patient and you know that you're at increased risk, we definitely want you to make sure that you're masking indoors. But in those places that are a high level of transmission, they are asking all persons to wear masks indoors.
All right, Dr. Celeste, thanks for breaking that down for us this morning.
No problem.